Welcome to the office.
All right. Hi. Florin, welcome to Alta Valley Hospital. It's a pleasure to meet you. Nice to meet you. Where are you coming from?
I'm coming from Romania.
From Romania. How long is the flight?
Well, from an hour from Cluj. I'm coming from Cluj to Bucharest, and then another 4 hours and a half from Bucharest here.
Okay, so a little closer than coming to LA.
Yeah,
A little closer. A little bit closer. Okay, fair enough. How can I help you? What are you doing here?
Well, I've been having problems with my spine for since I was like 20 years old.
Okay.
But in the last 5 years, I've been having a lot of problems with my hands. What made me come today was the fact that I have 2 kids. My daughter is almost 4 years old,
Okay.
and my boy is 1 year and 3 months.
Okay.
So he weighs about 10 kilos, and I can't hold them with my left hand. Like with my right, actually, wherever we go, and I'll hold him with my right hand, because with my left, I can hold him for like 3-4 seconds, and then I feel like my arm is gonna break or something. It's so painful.
It's pain first or weakness?
It's actually both.
At the same time.
At the same time, but regardless of how much I would try to resist, it's just the pain is so big.
And
It
he's
gets
10
so big.
And he's 10 kilos.
Yeah, he's 10 kilos.
So I'm assuming you can't even lift your daughter up then.
With the left hand, no.
Okay.
Well, actually, she's like 4 years old now. She doesn't need me to carry her around, but he wants all the time to carry him around, so he looks, but I can't do it on my. And what I just realized that if, in case, let's say, God forbid, his life would be on the line and I would have to catch him with my left hand, I would not be able to hold him.
Right.
So it's.
So you're concerned, Dad, and one is pain, and one is the pain and the weakness. But more importantly, it's because you have a 1-year-old baby, and you don't feel like you can actually, number one, hold him. Number two, if
You never know.
If there's a situation, you don't feel confident that you're going to be able to do something.
With my left hand,
Okay.
I'll grab him, of course, but.
What happened 5 years ago?
I'm not sure. I kept on thinking. I think I was working something with my dad, and I was laying like a balcony without the rail, so I was laying on my belly.
That's normal in Romania, or?
Well, no. We were doing something not
Okay.
right.
Okay.
So I was laying on the balcony on my belly.
Yeah.
I was holding a heavy piece of metal. To extend the balcony.
I got it.
And my dad was putting the bolts in, and I had to hold it for, I don't know, maybe 2 minutes.
Yeah.
And that's when I felt like a lot of burning here. And from that point, a week, 2 weeks later, I still had like sore hands. And in
Elbows, arms, hands, everything.
elbows.
How much did it weigh?
I don't know, about 80 kilos, I think. But it was the time that I had, maybe 2 minutes, maybe more, to
Sure.
put the bolts in. But so 2 weeks, 3 weeks, a month, then I realized it's not sore, something's wrong. And about, I don't know, at that point, I realized that I can't lift a bottle, 2-liter bottle of water with my hand extended like this. I couldn't lift it.
But you can do it then?
Like this, I could do it, yeah.
Okay.
So with both hands, I went to a lot of chiropractors.
Okay.
Somewhere.
People took X-rays? Did anyone
Yes.
take X-rays?
Yes.
Did they figure out what was going on?
No.
Okay.
Actually, out of them, two of the chiropractors, actually, they fixed it, almost fixed it, to the point where I could use my hands. I couldn't carry two kilos like this. A bag with 2 kilos.
Got it.
I would feel like this. My hands are breaking from here. Well, anyway, so 2 chiropractors were able to fix it. The first one, the fix hold
To help it.
To help it, yeah. So it hold for 2 weeks. I was in the driver's seat, parking. So I turned to grab my jacket, and that's when I heard it pop, and that was it. Oh, actually, after he fixed it, like my mind was so clear, like so present. And I think I also have my like a foggy mind ever since.
What did they work on?
Well, it was I was laying.
You don't know the segment?
Oh,
T1,
I know
T2,
here. Yeah,
T5.
T1, T2, T3. That's where I heard it. I heard it pop, but a small pop. He was holding my hand. I was on my back, laying on my back, holding my head like this, like with the chin, and kept lifting me up till I was like only my bottom was on the table, like the whole spine was hanging in the head, and then I heard it pop, and that cleared my mind and everything. But it was here.
Why did you go back?
I went. He's the chiropractor that fixed me when I was 20 years old. But now he's so old that he didn't work after. Like I got to him like in the last 2 weeks of his working life,
career,
right?
career.
Career, yeah.
Okay.
So then so I kept going and going, and after well, the elbows were again back to that point.
Sure.
So I kept going to different chiropractors, and so
And what was being worked on? Still T1, T2?
actually everybody was kind of working the neck. Everybody was looking at the neck. So
Guess what? I'm going to show you something different. Okay?
Yeah.
That maybe the neck is there, but you know, you've watched my videos, right?
yeah, I know. Yeah,
You've watched my videos, and you know the way I look at the body, the spine. It's a building.
Yeah,
So they're working on the top floor.
yeah, everybody.
Did anyone look at your foundation or your mid back
No,
as the
no,
cause?
no.
Okay.
That's
Because look, you're holding like this. Yes, you need the nerves for coming out of the neck for the upper body, but it's also all of this needs to be engaged too, right?
Yeah.
So if there's a weakness lower down, what's going to happen up above? It's eventually going to give out,
Oh, absolutely.
right? Okay. Sorry, didn't mean to cut you off there. So you were searching. You had any other relief from anybody else?
Well, yeah, another chiropractor.
What was adjusted?
Um,
Do you know?
it was adjusted on the lower back because I had problems there as well, but that didn't fix it. It fixed it just like he was a Gonstead chiropractor.
Oh, okay.
So,
country?
but he did it a bit different.
What country?
Italy.
Okay, cool.
So,
You took full spines. You had
Yes.
Yeah. So we had those Xrays.
Yes, we had them as well.
Scoping and palpation.
no scoping, no palpation.
The thing is, Gonstead is not a technique. It's a methodology. It's a mindset. It's a philosophy. Okay, and you're looking at things very different. So to give a Gonstead style adjustment, right? That's great, but you have to know why you're doing it. How did you find it? And there are criteria, right? First is history, visualization, scoping, static palpation, motion palpation, full spine analysis, look at the level foundation. You got to look at everything. And so I got a little issue when someone tells me that, right? But it's nice if, for example, we figure out that, hey, it's L5, let's just say, right? And it's L5, let's say you have a PRSM L5. Any Gonstead doctor will know what I'm talking about. I can say you have a L5 PRSM D3 D4 disc. That's a disc classification in the Gonstead work. So a Gonstead doctor will know exactly, even without an X-ray, you have a L5 PRSM D3 D4. He can visualize it in his head and say, okay, this is how I need to correct it. So if there's someone who does, let's say, a Gonstead adjustment, and they know that listing and classification, then maybe it's going to help you and save you some trips in the future. Okay, I don't know. Does that make sense to what I'm saying? I've even had a lot of guys come and wanting to visit me. They took some pictures with me, and then they went back to their country and said that I trained them. I didn't train them. Okay, you know, there's a lot of guys right now that want to come to visit. I don't allow it anymore because I've had a lot of bad experiences with that. But in the future, guys, God willing, we'll have some workshops and seminars in the future so people can come and we can start going through the process and the training. But for right now, you and everyone else out there need to understand this is a methodology. right? It's a
Yes.
mindset. There's a philosophy as the, you know, they say chiropractic is, and it's in the preface of the Gonstead chapters, science is knowledge reduced to law and embodied in the system. Art relates to something to be done. Science teaches us to know and art to do. That's by D.D. Palmer. And so and then we look at it, it's philosophy, science, and art. Philosophy is the why. Science is the what. Art is the how. You gotta have all three. Make sense?
Makes sense.
Okay. All right, let's continue. So that's neck. You had some low back. Let's go back 20 years or to when you were 20 for a second. You had injuries back then. That's when a lot of your.
Oh, well, that's when I had big problems with my back. I
What
wanted
happened?
to get an operation because I couldn't.
You
Like
had
in the morning.
discectomy? They cleaned your disc. You had disc.
No. I wanted to. I wanted to go to operation, you know, to have a surgical.
Sure.
Yeah. But my mom found about the chiropractor,
Okay, cool.
the guy that
Right on.
you know
That helps you.
retired now.
Yeah.
So I went to him, and he said I wasn't able. I was supposed to walk, but I was too young for like 20 years old. Like I had like 3 herniated discs in my lower back, and about another 3 or 4 a little bit upper, maybe. Well, anyway, since I know I've been watching your videos, I kept thinking for this visit. I do remember falling from a tree when I was like maybe the oldest that I could have been, 9 years old, but I'm pretty
It was
sure
right on
it
your
was
butt.
under 8.
It was right on your butt.
Straight on my butt.
Yeah.
I do remember it. Like it was in the morning around 10 o'clock. The whole day I could not feel my leg. It was numb. Some in the evening somehow I was just using the leg like a crutch because it just never felt. That's why I remember it. So it was, and I think in about a week or so the feeling came back and everything. I do remember when I was like 12 years old, 13 years old, the teacher told my parents that I'm walking funny, like with the leg somehow.
Sure.
So something. I do remember my parents told me, and they kept putting me walk, and
I got it.
so
I got it. So we have old injuries. You had old traumas. You had help.
yeah.
You got a lot of help, and then about 5 years ago, you were helping Dad extending the balcony, and something happened, and since then everything's kind of going downhill.
Yeah.
And the reason you're coming here is because you want to hold your baby.
Yes.
So what I'll do in subsequent, you're here for a few days, right?
Yes.
Okay. So I'll probably go down to the physio department and grab some weights. Okay.
Okay.
All right. We'll grab some weights and we'll see that can you actually lift it or not.
Okay.
Sound good?
Yeah.
Let's go over your X-rays now. Let me explain everything that I see, and we're going to examine you and figure out where we're going to start. You ready? Yeah. So when we're looking here, the first thing we're going to see is there are curvature issues in the spine, right? Starts here. There's a little imbalance that makes the spine go to the left. It curves then to the right, straightens, goes again to the left. So there's a lot of imbalance before you even get to your neck. Make sense?
Yeah.
Okay, so let's go over now your foundation, and then we'll go closer from there. So let's do a couple of lines. Your base is good. That's the first good news. Okay. We have a little bit of rotation of the pelvis, 3 millimeters. It's not a lot, but it is a little bit there. It looks like we have a rotated sacrum on the left side, if I'm not mistaken. Yeah, we have a rotated sacrum on the. So 66 and 59. So it's a rotated left sacrum. The tailbone is turning this way on the left side, and that, along with, there's a little bit of imbalance in the sacrum. You can see that's from your tailbone injury. So the imbalance was created from your tailbone. Now I'm going to show you here where it's coming from. It's starting here at the coccyx. You have slight posterior coccyx. And that's where we have to start. That's number 1. There's a swollen S1 disc that relates to the rotated sacrum. If I'm going too fast, you let me know.
No.
There's a lot of information. Okay. So those are the two majors first in the tailbone we have to look at, okay? Coccyx and S1. From there, you can see L5 is kind of worn out a bit, right? L5 is worn out a bit, but you still have decent space there. The only thing is because the tailbone is off, there's a little bit of that calcification here. So we got to get this tailbone stabilized so we can get to this L5, okay? And as we go up now, let's go up. I want you to see something. This is compensating, this is compensating. So these are actually all compensating, and then it levels off back here again. 5, 4, 3 are compensating for your tailbone. 2 levels off, 1 levels off, 12, those are fine. You have an old compression injury.
Yeah.
So we have old compression injuries, but the discs are fine. These discs are all fantastic here. This one looks a little bit swollen there, 7, 1, 2, 3, T4. Okay, T4. And if we look at your neck, here's the interesting part. Your neck curve is actually good. But there's something hiding in there I don't think anyone found. It's your C3. C3 is a little bit off. So we have C3 potential, T4, S1, Coccyx. Now the interesting thing is, someone may talk about right now after watching what I just said, how did he see it on the lateral X-ray? He normally does it on the AP X-ray. Well, the way I was actually trained to find subluxation compensation was you first look at the lateral. The lateral X-ray gives us the answer, gives us the vertebrae that caused the problem, okay? The AP X-ray actually tells us how to correct it. Now, let's go over here to the AP. So, we can see, right? There is a little bit of rotation of the pelvis, but I'm not so excited about that just yet. I'm more excited about getting the sacrum and L5 sorted out for you. Now, from there, all of this is compensation. But if we go up higher now, and let's see, we know T4 is an issue, but I think maybe we missed something there. And I think we did. 1, 2, 3, 4, 5, T6. T6 is a major shift, which is, I feel, T4 is there on the lateral. T6 is compensating right here. I want you to see this. You see these pedicle shadows, these circles? Mm-hmm. They look symmetrical, starts to change, small, big, small, big, small, big, and then there's a hard shift. You see that?
I see.
So the whole neck or upper back is doing this. 1, 2, 3, 4. T4 is also an issue, but it's T6 is where that major twist is happening. And you can see the ribs are a little bit different, connecting a little bit different there.
And now that you're saying,
so it's actually starting from here, which is coming from here, which is coming from the left side foundation. That's what I'm seeing so far. Now, there's a little bit of nasal septum issue. You have any breathing issues?
yeah.
No, we'll work on the nose at some point on this trip, okay? You got a lot of digestion stuff going on. You got a lot of inflammation, you got a lot of fermentation, a lot of gas. Control of that starts where? 6. T6. And I will have to give you something in terms of a supplement to start to kind of speed up the process because we don't have the luxury of time.
Yeah.
Okay, and you're over 40. All right. Does that make sense, sir?
Yeah.
Let's go to the other one and then we'll get started. So, C3 I see. Let me see if I can. If 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6. Actually, 6 is there. It's more subtle. T6 is there. It's more subtle. Okay, you see this looks level, right?
Mm-hmm.
That looks level. That looks a little swollen in the back there. That looks more swollen. But if we have to choose between 4 and 6, I'm probably going to choose 6, depending on what I find on you. Okay?
Yeah.
Questions on this?
No.
Okay.
Yeah.
Shoulders, we'll deal with the extremities, but number one today, we got to find where the pressure is in the body, and most important, we got to get your foundation stabilized. Okay?
Yeah.
Let's do it. Yalla. Starting at the base of the neck, head down, please. And the first thing we're getting is 25 points, C6, left side. I'm not too excited about that one. 15 points. So we're gonna wait, it's shifting around here. Look straight. If he looks straight, let's see what happens. Yeah, it's there, but it's reduced significantly. It's 5 points in that position. So when he's looking down, he's actually creating more pressure in his neck. Posture is gonna be the key for you. So when you're carrying, well, we'll get to that. You came solo by yourself?
Yeah.
There, T4, left side, 10 points. T6, 5 points, right side. Doo-doo-doo-doo. There it is. S5, coccyx, left side. All right, let's go ahead and check the motion of the pelvis, feet together. Open and close your knees with your feet touching, good. And we're checking general motion, slow it down please. Feet are touching, right side only. So with general motion, when he does one side, we're looking if there's a shift in the opposite side. No, right side first please, only the right knee. Open and close, open and close, open and close. So when he does that, there is a slight little shift, but not too bad. Left side only. Yeah, same thing. When he's doing that, there's a slight, but it's not too bad. Now, let's go ahead and do static palpation. Head down, running our fingers down the spine. We're looking for swelling, edema, point tenderness. And what you can see when we're running our fingers right there, that's T4. A lot of edema there, and it turns red right there. But look, it's still there. All this swelling, look at that. It's very subtle. And then as you go, it starts to get less, okay? So this is his area. If I have him bend forward slowly, we can see the bumps here, right there, but then it disappears right in that T6, T7 area. So I'm actually more excited about that one first. 1, 2, 3, 4, 5. That's 6. That's 5. 5 more tender, 6 more tender. That's 7. Let's try that again. Head down. 7. 1, 2, 3, 4, 5, that's 6, sorry. You feel that, right?
Yeah.
T6. 9, 10. Okay, let's go and check his tailbone. Back slowly towards me, sir. L5. That's 5. Little tender.
Yeah.
That's 1. That's 2. That's 3. That's 4. That's 5. And I'll be on the outside. So what's interesting, most of the time the coccyx will, right there, that's the coccyx. So what will happen is most of the time that coccyx will go anterior. Yours went posterior. So that was a significant trauma. We gotta push that thing forward. You feel that, right?
Yeah.
Coccyx, T6. Slide up. And why is the coccyx so important? Because if we look, the spinal cord ends around L1, it becomes a string, the filum terminale ends at the tip of the coccyx. When the coccyx misaligns anterior, it causes a slight loosening or loosening of the tone. There's less tone in the nervous system. B.J. Palmer talked a lot about tone. Now, when it goes posterior, it's pulling it. It's tense. That's that stress, the anxiety, you're always tense, tight. Okay, so hopefully we're gonna be able to relax you a little bit today, okay? All right, let's check the neck. Sit back for me, please. Head down. Doo-doo. That's 7, 6, 5, 4. Now, I know we're gonna find something here. You felt 6 a little bit, but I wanna show you something here too. That one right there. Right there. That's the one hiding, okay? That's the little bugger hiding. You feel that, right?
Yeah.
Yeah.
On the left side.
Yep. Head down, please. Let me recheck. There's a lot of, you're like the onion. We gotta peel the layers of the onion, dude. Now, this is what's interesting. Check this out. 6 is there. Three is also there hiding out. No kidding. Relax there. There it is. I'm gonna correct myself. C3, C6, T6. Coccyx. Okay, stand up, let's have you walk. Now, go ahead and let's walk to the corner of the room and back, please, a couple of times. I told you he's gonna have the Romanian wiggle. Let's put the slippers off if you don't, take the slippers off if you don't mind. We wanna see him walking through his dimples. And when he walks, he's shifting like this. You shift like this when you walk. You don't do this. Walk one more time, please. And just take a look at his overall walk when he's walking, right? You can see the imbalance. He's kind of tilting to the side also when he's doing that. One more time.
I'm under the impression that I put the left leg under myself.
Yeah.
Somehow.
That's because the tailbone is tilting on the left side. Have a seat. Game plan time. Let's get started, dude. Show time. So I'm gonna do posterior coccyx first and C3. And then I'm gonna recheck you. A little different than what I thought. Come on over. Coccyx, posterior. Relax there. Good. So I'm gonna be I'm gonna start it here, okay? Nice and easy there. Shh. Let it roll. Let it roll. Let it roll. Gotcha. Perfect. Come on up. Walk it off once, please. You see how his dimples are moving up and down already? That's freaking cool.
It feels something's.
Walk here, dude. You got a freaking brick hand, dude. Don't hurt me. Come over here, please. Different.
Yeah.
Now for the posterior, I'm not lifting it and sliding it. I'm setting it just a little bit more. There we go. There we go. Okay, let's bring him up. Okay, come back over here, please. Let me tuck the gown in. Let's watch the walk and then we'll continue. All right, go ahead and walk, please. You do feel the difference, right? Come on, your dimples are moving like this.
Yeah, it feels easier.
More freely. Come over here, have a seat. You're gonna need a donut pillow. We're gonna need to find a donut pillow today. We're gonna get one of the pharmacies. Because in order for that tailbone to hold, you're gonna need it for at least a couple of months, okay?
Okay.
So let's do C3. 2, C3. 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 Nice and easy. 2, 3. Come under. You gotta hold it, okay? Don't let go. You gotta come under, drop. Good. There it is. Good. Perfect. Gotcha. Deep breath in. Blow it out. Walk one more time and come back. Awesome. Back in the chair, let's rescope. So that's the first layer of the onion, okay?
Okay.
Let's see. Head down. A lot of shifting. We will still do 6. Let's see what happened here too. So T4 cleared up right now, okay? Just for right now, T6 is still there. Oh, there it is. 1, 2, 3, 4, 5. Right there. 6 or 7? 6. 6. Okay. Let's go do T6. Let's go back down over there, please, on the gray table. And there's a lot of rotation there, so I'm gonna do it. 1, 2, 3, 4. Shoulders down. That's a piece. Drop the shoulder down. There you go. Cool. Walk it out, sir. What's different?
I feel like it's I'm feeling more freely, more. It's moving. It's
It's a little different than what you were seeing before.
He was.
Have a seat. Put your left hand out. Hold it up. Hold. Hold. Your left hand out. So from here it's okay. Straight arm. I'm going to do it here because remember, basic physics, right? The further away you go, the more tension you're putting on it. Force times distance. Straight. So elbow, you're fine.
Yeah, it's
Now here.
now it's actually maybe I should have. I don't know if I still have the problem with the bottle, but I do have it
The
when,
baby.
when I'm holding him like this, like in
In
under
your
his-
palm?
Yeah, in my
And
palm.
how long?
3 seconds and that's it.
Can you go grab a baby from maternity ward? I'm joking. I'm joking. That's killing. Little more of 3. Little more of 3. There's the rest. Okay, go like this. Stand up. Like you're holding your baby. Turn this way. Come on. 5, 4. You want to carry me? 5, 4.
I think it's fixed. I still feel,
But it's different.
But I can hold, I can. Even though it is, I still have a little pain, but it's not as big, because I have to. I used to have to let it down,
Let it
but
go,
now
right?
I can hold against it. It's not as.
Neck is clear. All clear. You remember what the low back felt like? I'm gonna re-motion you, okay? Come back, check it out. 5, that's 5. That's 1. That's 2. That's 3. That's 4. That's 5. That's the coccyx. Different.
Oh, good. Sweet.
Let's buff you out now, dude. Right on, man. Is that sharp now in here when I'm pressing? Lots of walking, okay, while you're here. So I didn't actually touch C6 or T2, right? I did C3, T6, and coccyx. Left arm, let me do the work. Let me do it. There you go. Let me do it. There you go. Stand up. Let's check the hands. Slow. Turn over here. You're strong. Slow, please. Squeeze slowly. Bus. There we go. Slow. Elbow. Posterior humerus. I'm on the back side of the humerus here. There. Now I'm on the radial head. There. Now I'm on the lunate. There. Now I'm on the scaphoid. There. Squeeze. Nice. Squeeze. Make a bicep muscle like this. Hand flat though. Welcome to the office.
Thank you.
Questions with what we did? Homework. Walking, icing, enjoy your time while you're here the best you can. Okay? We'll test out tomorrow with 10 kg and 15 kg, and then we'll do 20 kg by the end of the week.
Okay.
Fair enough?
Great, fair enough.
Show them. Nice to meet you, brother.
Me too.
All right.